A very good morning to an august audience, and thank you to Dr. Indramohan and the panelists. So, thank you to Dr. Nalini ma'am for making my talk a little easier and sharing the difficulties which NGOs have for doing eye care. So, bridging gaps in vision care through public-private partnership in NCR region. So, I am practicing in Delhi and Gurgaon and Noida and Faridabad regions. So these are basically the near capital regions, and it is mostly the urban population that we are catering to. And so there is a lot of there are a lot of hospitals, but still people miss out on the healthcare. So about the global blindness statistics, that IAPB Vision Atlas and the Lancet Global, the 90% of the vision loss can be prevented or treated. So most of the vision loss and the blindness that we have and the refractive errors that we have, so the number is humongous. So we have to, as private practitioners also think each one can do something. So each ophthalmologist has that, that potential to take care of so many people. So at least 90% of the vision loss which can be prevented or treated. So I think with technology and other things which are upgrading in ophthalmology, and you have now non-mydriatic cameras and fundus photo cameras through which our screening of glaucoma patients and diabetic patients have become much more easier. So like 10% of the vision loss from the conditions that require ongoing management, treatment, vision rehabilitation can be very easily tackled. So these are basically the statistics in India, that 4.95 million there are blind people which are there, and 70 million people who are impaired, and there are many causes for it, and the maximum cause is the cataract. So there is still a lot of cataract burden which is there in India, and related to cataract, diabetic retinopathy, glaucoma, these are the other things which actually lead to the visual impairment. So these are the various areas. The more orangish or the reddish parts are where the load is the maximum. So where is the role of the private practitioners? So once I started my residency, I was part of the screening camps in and around Ahmedabad. So this was my first camp. When I joined my residency, it was the first month itself, and one of my colleagues, senior colleague practitioners, asked me to do a screening camp for the. So this is my first venture into doing the camp. So I just kept this photograph since, like, now it's almost 19-20 years, and I still have it with me. So once I started my private practice, then in and around my clinical area, there were many RWS societies. So RW is a resident welfare society. So usually in most of the cities, metro cities in India, you have RW cities, and there are where you can go and make people aware of diabetes, glaucoma, so that most of the people don't even know about such conditions. Despite so much of modernism and scientific advancement, still people are unaware. So we started evaluating in the neighborhoods, and we found that still there are many people in and around us with, like, somebody is a guard and their kids come around and show to us, and then we make sure that these kids don't go back, because if you are not treating that refractive error, and we make sure that we give them glasses or something we do from our end as a private practitioner. So and we also align with the general practitioners, and because they screen for diabetes and other things, like ma'am was saying, like NGOs have a big helping task force, but our helping task force are usually the GPs. So they help us to align the camps with a diabetic screening camp. So if they are keeping a diabetic screening camp, then we also do a general eye checkup camp. So here you can see we have actually done a diabetic screening camp, and we screened around 100 people for diabetic retinopathy during this camp. And we partnered with the neighboring schools also. So the private schools also we partnered, and we do screening, because sometimes private schools also have a charitable wing where in the evening they have children who are coming from the neighboring societies, and they get education. So we screen for them also. And definitely keeping glaucoma awareness and awareness about diabetic retinopathy, which is much needed. So we keep organizing small activities around our neighborhood, and usually March is a glaucoma awareness month. So that is a time when we raise awareness all around the world actually for glaucoma. And during celebrations and community services like Saraswati Puja and other festivals, so around that time when other things are going on, then we associate and sometime with the local shopkeeper associations that in and around our areas we also do. So Nehru Place is a very big area where there are shops. So we because most of the shopkeepers spend time with the businesses. So they are like from morning 9 to evening 9 o'clock, they are spending 12 hours during this. So they don't get the time for their health checkups. So we organize that also. And we organize with various corporate hospitals also. So as an individual doctor, I am associated with many private corporate hospitals. So sometimes we cooperate with them and with the other NGOs like Satya Sai, and there are many in India. That is the boon that there are so many charitable organizations which are there. So you have to you can cooperate with so many other local sansthas or corporations, you can say. So we collaborated with Delhi Police also, and we did a lot of camps with them, and we collaborated with various religious organizations like Radha Swami Agra medical camps. So we did screening for them, and we do it regularly. So and we organize with the charity missions also, like the Christian charity here. The doctor is she has her own practice, and she invited us to screen for people. So we screen 100 people there. So good team is definitely very important. So main our strength are the optometrists, and they help us screen people, and they form a very good team, which is essential to screening. So we also did a screening camp where we screened 6,000 kids in 2 schools, 2 government schools, and so you can see in the lower photograph there's so many girls who are myopic. So in one of the classes there were 50% of the girls who were myopic. Where this is a 6th standard class, but like junior high school, and so I've just taken a photo of the autograph also, that it is -5 and -2 cylinders, and so many kids wearing glasses. So it has actually increased over the 10 year of practice, 15 year of practice, which we are seeing. The myopia has definitely increased, and we distributed the glasses also to these kids in the schools. So we do a private eye screening at our clinics in Gurgaon also, and this was done in Tughlakabad area, and this was done in 18th February 2024. We do regularly at Najafgarh. So every month we organize a camp. So it is throughout this thing. I will not take much of a time, and so these are just a few photographs from that. And what we do is also we sometimes take spectacles, old worn out spectacles from people, because once you use it, maybe you throw it at 6 months, but it can be used again with proper putting of the lenses, and it can be used again. So we have done that kind of donation. These are the regular camps we have done in and around Delhi. And this is the spectacle distribution, where we refurbish the plastic frames and put in the new lenses and give to kids. So this was a class 12 student who actually donated a lot of 100, 200 glasses for this cause. So this we did in many schools in and around Gurgaon also. 4 schools we did covered, and we did with Earth Savior Foundation also. On 19th of October we screened 100 people. So we are constantly trying, and whatever small things we can do, but with obviously with the cooperation of the NGOs and the government, we can do a lot of things together as a private practitioner. Thank you for this talk.
Yeah. Thank you, Dr. Kenshuk. So in the meantime, I invite Dr. Manpreet Kaur to have his topic on collaborative models for addressing blindness, different approaches. One point thing on Dr. Kenshuk's by Dr. Dole or Dr. Rohan. One point.
Thank you, Dr. Marwah. It's really a good job. And I expect all this from my other colleagues also who are involved in practice, and I always tell that this is a specialty, this is an area which gives an opportunity to serve the humanity. And if you spare minimum half a day in a week for this job, it pays you a lot. And I may tell you, it's not free. You are doing free, but dividends are very high. Means those people who get benefited, they are your ambassadors. They tell other people that look here, there is a doctor who examines you free. And one area which must be covered is, which we are forgetting, is the urban slums. There are a lot of problems. We focus on rural areas. We talk about rural area, but urban slums are equally bad. Thank you very much.
Thank you, sir. Thank you.
One comment from Dr. Harjot Madan.
Dr. Kenshuk, you are doing very good work. Just one point I would like to add. Like you said, in schools there were more than 50% of myopic kids, and I think there should be awareness about the use of digital devices also, because kids are using mobiles a lot. So this is the main reason of increasing the myopia. So they should be given awareness.
I think this problem is more COVID induced, because before COVID we could
Yeah.
tell the parents that don't use
Yeah.
digital devices.
Yes.
But after COVID,
After
there's
COVID,
so many online classes and this thing that
So they get excused.
Yeah, so they say that Papa फिर किस पे पढ़ाई करेंगे, and kids are so smart that while they are attending the classes, they would put up an online game and do the gaming with that.
And myopia management is now a regular part of any eye care organization, whether it is private or charitable, anything. So we need to focus more on particularly urban areas where the consumptions of this digital gadgets are more. So it's like very nice presentation. Thank you.
Thank you, sir.
Thank you. Especially the school children, they need attention at that age.